Hello and welcome. How are we feeling today? All right. Well, I see it's been a while since your last visit. Let's see here. Last appointment was almost 4 years ago. Maybe a little longer? No follow-ups, no labs since then. Well, that's okay. You're here now. That's what matters. I'm just going to start by reviewing a few things, just some standard history, all right? Any allergies to medication? Any recent surgeries? Are you currently taking anything? Prescription, over the counter, supplements? History of asthma, diabetes, or high blood pressure? A family history of the same? And any hospital stays in the last 2 years? Let's see. I notice you left this section blank. Yes, this section, current symptoms, mental health, sleep, stress levels. Yeah, I noticed you left that empty. Okay. I'm gonna be honest with you. This makes me a little bit concerned. Yeah, blank sections like this, they don't usually mean nothing's wrong. They usually mean something's wrong and I don't want to talk about it. Look, I'm not trying to pressure you, but I am here to look after you. And that means I ask the hard questions, even if they make you uncomfortable, okay? Especially then, in fact. Oh, hey. Hey. You seem a little anxious. That's all right. How can I tell? Oh, well, just by your hands and the way you're holding yourself, you seem a little tight and guarded, but it's okay. I've seen that before. People walk in feeling like they need to hold everything in, you know? Be strong, stay quiet, or not be a problem. But let me say this clearly. You are not a problem. You are not a burden. And you don't have to earn the right to be cared for. But I can't help you if you don't tell me what's going on, right? And I can't treat symptoms you won't tell me about. You're scared. I get that. But we're not on opposite sides here. I'm your doctor, not your enemy. So take your time, take a few deep breaths, but be honest, okay? I'm listening. I'm not going anywhere. All right? There you go. That's it. Just breathe. Take your time. Hey, you don't have to answer everything at once. Here, it's all right. Okay. So, have you been tired lately? Okay. What kind of tired? Does a good night's sleep fix your tired? Or, okay, not the kind of tired that a good night's sleep fixes. It lingers even after you got a good sleep? Okay. Trouble focusing? And hard to get out of bed? That's important. Thank you for telling me. let's keep going. You mentioned skipping meals. Is it because you're not hungry or because eating feels like too much lately? Okay, that helps. And what about sleep? Are you falling asleep, staying asleep, waking up feeling rested? None of the above? Okay. I see. Have you been experiencing any chest tightness? All right. And when did that start? Hmm? Weeks, months? Does it come and go? Or is it always there? I'm not asking because I don't believe you. I do. I'm asking because I want to understand the full picture, and the only way I can do that is if you tell me, okay? And if I have all the pieces. Hey, can I tell you something you might need to hear? Look, I've seen a lot of patients over the years. Some people wait too long, they feel really ashamed of their symptoms, or they convince themselves it's not that bad. Other people have it worse. I'm being dramatic. Sometimes, by the time they walk through that door, things are really bad and a lot more difficult to fix than if they came in a bit earlier. Hey, no, I'm not saying that to scare you. I just don't want that for you. All right? You don't have to totally crash out for me to care. Okay? You don't have to be completely falling apart to deserve help. Yeah, you're allowed to ask for help before it gets unbearable, okay? So, let's do this together. I'm gonna ask you a few more things, all right? Have you noticed any rapid heartbeat? Hmm. Shortness of breath when climbing stairs or walking? Any dizziness when you stand up too fast? Headaches? Especially ones that come with nausea, light sensitivity? Okay. How about your mood? Irritability, sadness, feeling kind of numb? Mm-hmm. Any thoughts that worry you? Okay. Repetitive thoughts? Anxious often? Oh, I know. You don't have to answer all of it right now. Yeah. But listen, even if one of those questions made something stir in your chest, that's worth exploring, okay? Yeah. I'd like to take a good look at it, all right? Hmm? No. You're not weak. You're not broken. What? Of course you're not wasting my time. You're doing the bravest thing a patient can do. You came in, you're asking to be seen, okay? I see you. All right. Let's start with a few basics. If I can get your height and your... No? Okay, no problem. We'll skip the scale for now. That's okay. You don't have to explain. Yeah. You have full autonomy here. Yeah. I'll just make a note and we can revisit it another time if and when you're ready, okay? All right. Let's begin with the eye chart then. And take a look at the chart on the wall. Can you read the top line for me? Good. Now the third one down. All right. And the fifth? You're squinting a bit. No need to push. Just let me know when the letters stop being clear. Got it. doing fine. I'm just going to take a closer look at your eyes in just a minute here, but based on this, I'd recommend making an appointment with an eye doctor. Just to be safe, nothing urgent, but I think it's worth checking on. Now, I'm going to check your vitals, okay? You just sit back, breathe normally. You're safe here. All right. Blood pressure is a bit elevated, and your heart rate's a little fast too. That could be a stress response. Anxiety can do that. It's a lot more common than people think, but we'll keep an eye on it. Okay? No, you're not in danger right now. No, you're not doing anything wrong. This is just information. It helps me take care of you. Okay, open your mouth for the thermometer, please. All right. Your temperature is perfectly normal. Let's take a moment. You're doing really well. Look, I know exams like this can stir up all kinds of feelings. But you're here. You're cooperating with me. And you're allowing yourself to be cared for. That matters, okay? I know that's not easy for everybody to do. All right. Now, I'm going to take a look at your head, ears, eyes, nose, and throat. It won't take long. Start by looking straight ahead for me. I'm going to shine this light in your eyes. Okay? Good. Now, I'm going to ask you to follow my finger. Here, 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 and here. I'm noticing your pupils are a little bit sluggish, but that could just be tiredness or screen strain. Nothing alarming. No signs of infection. Let me check behind your ears. No tenderness. That's good. Now I'm going to look into each ear. You might feel a little pressure, but tell me if anything hurts. Ear canals are clear, no swelling. Tympanic membrane looks intact, pearly and healthy. Now tilt your head back just a bit. Say, ah. There we go. Throat's mildly red. Any soreness recently? No? Okay. Well, there's no white patches and your tonsils look normal. All right. You're doing great. Okay. All right. We're going to finish up with a few final checks here. I'm going to feel under your jaw and down along your neck. Just checking your lymph nodes. You might feel a little pressure. You let me know if anything's tender, all right? No swelling, nothing enlarged. That's a good sign. Now I'm going to take a listen with my stethoscope. Now, deep breath for me. And out. Again, deeper this time. Good. And one more. In and out. Perfect. Lungs are clear. No wheezing, no crackles. Let's take a listen to your heart now. Just breathe normally, okay? Steady rhythm, no murmurs, no irregularities. Everything sounds great in there. gonna gently press on your abdomen now. Tell me if anything feels sore or uncomfortable. Okay, good. Nothing unusual. No tenderness. Just need to listen. And bowel sounds are normal. Okay, good. You're doing just fine. Let's check your reflexes now. Just a little tap here on the knee. There we go. Nice response. Other side. Good. Strong and symmetrical. No neurological red flags. Okay, so here's where we are. Based on the exam today, I'm not seeing anything urgent, but there are a few things I want to follow up on. Your elevated heart rate and blood pressure could be stress related, or they could be a part of something more. It's too early to say for sure. That's why I'd like to run some blood work. Just routine labs. Thyroid function, iron, B12, vitamin D, and of course a basic metabolic panel. No, nothing scary. It's just information. Yeah, it's very routine. It gives us a clearer view. Also, the difficulty you had reading the eye chart, I really do recommend seeing an eye doctor for that. It could be vision strain, but possibly something like uncorrected myopia or even migraines that could be causing visual strain. Maybe from the stress that's been affecting your headspace? Okay. Let's rule out the basics first. And I'll go ahead and put in that referral for you today. Okay, great. Let's just talk about some gentle lifestyle shifts. Nothing drastic. I'm just thinking more consistent meals, staying hydrated, little walks outside when you can. Not because you should or to fix yourself, but your body deserves to feel supported, okay? You deserve that. Hey, listen. You did really well today. Yeah, I know you were worried about coming in. I could see it on your face when I walked in the room, but look, I want you to remember this. Honesty isn't weakness, okay? You're not too much. You're not wasting anyone's time, all right? Everything you shared with me today just helps me take better care of you. And hey, listen, please don't wait until things get unbearable next time, okay? I'm really proud of you, though. You showed up, you were honest, and you're letting me help. We're a team now. You're not alone in this. All right. Any questions for me? Okay, that's everything for today. I've sent in the lab order. You can get those drawn here at the clinic whenever you're ready. They'll only take a few minutes, and I'll call you as soon as the results come in. Yeah, that referral to the eye doctor is all set too. You should get a call from their office within a few days to schedule. We'll follow up in about 2 weeks. Please call in sooner if anything changes, all right? If you start feeling worse, if anything new comes up, don't wait. You call the office, okay? Yeah, I don't want you carrying this alone. Not anymore. Also, I really want you to remember how hard this was and that you did it anyways, okay? Yeah. You made the right choice today. I'm really proud of you for that. Okay. Take care of yourself. I'll see you soon.